So there's been some buzz on social media about whether or not homeopathy should be given prophylactically, which means given before signs and symptoms or given to try and prevent things. And the anti-vaccinosin is not really in that category. There are lots of brilliant classical homeopathic practitioners like Dr. Richard Pitcairn that has an incredible parvo distemper prophylactics if people don't want to be vaccinating their dogs and cats that he's been using for decades. And there's many classical doctors, classical homeopathic doctors that do prophylactic. So I want to talk about the anti-vaccinosin a little bit and why we feel so strongly about it and how to actually use it within the protocol and how often you can use it. So initially we started off by saying to use it twice a day for 2 days as an initial part of the protocol. But the amount of emails that we got back saying how just within literally a few short days, how they started seeing changes in their dogs, even though the symptomatology maybe doesn't actually match those two remedies, which is thuja and silica. The reason that's happening is because symptomatically what vaccines do, they layer a unorganic disease onto the body that manifests in all different ways, from depression to anxiety to aggression to skin disease to arthritis to autoimmune diseases to all different things. Thuja and silica are two different remedies that the old school classical homeopaths found to be in the top 5 to reduce the symptoms or alleviate something called vaccinosis, which is the side effects of vaccines. We have seen dramatic improvements in animals before they even start the rest of the protocol, just using anti-vaccinosis. So what we've done is we're recommending now to people that when you're on the protocol, or let's say you're just using the anti-vaccinosin on its own and you see a result, but then that result starts to just stale, right? So they let's say they get 25% better with whatever symptoms that you're dealing with, and then they stay at that 25% better. You can actually repeat the anti-vaccinosin to kickstart the improvement again. And what that actually means is that your dog or your cat has had a vaccine trauma or something that has drastically changed the vitality or the vital energy or the chi of your animal that you sometimes don't even know that it's happened till after you've done the anti-vaccinosin. And then all of a sudden we get emails saying, Julie, is it possible that my dog or my cat has more energy? Or is it possible that my dog's not as anxious? Or is it possible that it's not as aggressive? The list goes on that aren't symptoms of the remedy, but a manifestation of what the vaccine caused. And then when the remedies alleviate that layering, those symptoms improve. So you can repeat the anti-vaccinosin so long as you're getting improvement. Once you get improvement, that means the body has responded to the remedy, and then you stop. So you can repeat it, once a month. You could repeat it even up to once a week. But when you're seeing constant improvement, you don't have to continue to repeat it. Stop, wait, and then if it stalemates again, then you can repeat the remedy again. And when you repeat it, you do it the same way. You do it twice a day for 2 days, and then you stop. So homeopathy is a incredibly interesting modality of medicine that I could talk about for 5 hours because it's my passion, one of my passion other than my animals. And I just wanted to clarify that many classical homeopaths use prophylactic homeopathic procedures, and it doesn't dilute the fact of whether they're classical or not, or does homeopathy work prophylactically. And vaccine-induced disease is in a completely different category within its own right. So that is the history behind our anti-vaccinosin and how to use it. I hope that helps.